Greetings, all. I just wanted to do a quick video um, on the steps that I'm using to grade your final paper, and also the some additional tips for the final presentation. So keep in mind the bulk of your work is the final paper. The presentation is a brief summary of your final paper, and it's essentially the marketing aspect of your paper. So or of your idea, and we'll talk about that a bit more when we get to that. But this is essentially the form that I'm using. I scrolled down because I didn't want to include the student's name here. But basically, I'm just going to go through everything that's in the rubric, and I'm just going to, make sure that you followed all the instructions, all the guidelines that are up there. So make sure you do an introduction to the disease that you're talking about, the morbidity and mortality rates, etc. Talk about the previous literature in this subject, particularly public health, from a public health perspective. What type of public health uh, programs are out there already, and which ones have been successful and which ones have not, and why. Talk about the needs assessment, of course, and a lot of this we've already done. Many of you are essentially, I'm sure, just cutting and pasting at least part of it, and you're always refining your work as you go through each discussion and kind of build this up into a final paper. Um, Make sure you talk about the appropriate shareholders. Again, um, you want to essentially restrict. I don't want to use that word restrict, but you want to identify specific targets in your community. I know a lot of people love the idea of running it in churches and schools and geriatric care facilities and workplaces, and just have this huge program all over the place. And it's not going to work that way. You need to do it at one place. So either a school or a workplace or a church, one place, or do it at a hospital, and do like some type of a community program, one program at a hospital, because you need to essentially, it's great to do a program that targets 3,000 people, but sometimes you don't have the resources to do that, and you have to keep in mind you need to measure, you need to make measurements, and you need to identify the measurements that you're going to make. So, and we talked about that before. So just make sure you talk about that. Make sure you talk about the logic model. Um, or excuse me, make sure you talk about the activities and outcomes, and you have a nice big section on that, and specifically stating which shareholders are going to be engaging in which activities. If you're talking about carrying out health education programming, make sure that you have the appropriate public health people doing that. Public health nurses, especially. If you have, epidemiologists is only 1% of public health, but you might need an epidemiologist, but probably not, unless it's like to help guide the program, maybe. That would probably be what it was. But as far as the background research, a lot of that research is already done. Okay, so, and then the logic model is just a summary of the activities and outcomes. And again, make sure you do the quantitative and qualitative analysis. Make sure you have a nice conclusion, and make sure that everything is kosher with your spelling and grammar. The first thing I do is run a big spell check because I have issues spelling myself, and I rely on those tools as well. So make sure you're using those. And again, at this level, I don't see a problem with that very often. Oops, I didn't mean to. Well, this was a very good paper, so I don't mind showing that student's name, but I'm trying not to show the students' names here. These are what I did, I think, last semester. Um, so again, what previous programs were successful? What evidence is out there to support this? I think this someone talked about epilepsy, and they said, no, make sure you get vaccination. Well, there's no vaccination as far as I know for epilepsy. Uh, Not as far as I know. I know there's no vaccination for epilepsy. I don't know why they would make that recommendation necessarily. So I kind of threw that in there. But sometimes people will just throw things in without citing any evidence. So you make sure you cite your evidence if you're making claims. Okay, that's another thing. And if you're taking, you again, you folks know how to write a paper. I'm not going to go through the citations and things like that, but make sure that if you're making claims, you're citing that evidence. Again, we kind of talked about this already. One thing, so sometimes people don't include an evaluation plan. Sometimes they'll do it in the paper but not in the presentation, or sometimes they'll do it in the presentation but not in the paper. So again, the presentation is a brief summary of your paper, but it has all the same components that you're going to discuss. One thing that I don't have it up here, but one of the, as far as a word count is concerned, I don't have a specific word count written up in the rubric, but in general, one of the some feedback that I gave a student said that the word count was 900 words, which was short relative to what everyone else in the class had written, and that is essentially what you're doing. You are I'm I'm comparing the students are compared to each other. This is a peer, I don't want to say competition, but you're essentially you're demonstrating your ability compared to your peers. So I expect that you're doing it as much as your peers, and the average has been 1,500 words to 2,000. Some students really get into this and will write 3,000 words. But a 3,000 word paper can be good as long as it's valuable 3,000 words. Sometimes people will write 3,000 words and it's just redundant information over and over again. That's why I don't like to do necessarily a word count. So make sure, as long as all the information is here that we just covered, as long as you're covering all this information, you have no problem getting up to 2,000 words. You can get up to 1,000 words easily just on the introduction and literature review. Easily. I could give you 1,000 words on virtually any disease in a matter of probably an hour or so. But I've been doing this for 20 years as well. So, just take the time and do it. And again, you have until Sunday night to hand these in and to submit your work. I know it's a little bit late. I apologize. I'll show you a picture if I have some time here. This is just some previous presentations. One of the reasons I wanted to show this one was, and again, these are cool presentations. I don't mind showing the students' names. In fact, the students presented these in previous classes anyway. So the papers, I don't necessarily want to show my feedback on the papers. I'm trying to hide their names, but these are really great. And one of the things that I want to mention is that, again, this is the marketing aspect. Okay, this is Shark Tank, and you're trying to get funding. One of the ways that you want to do that is I'm just going to go through this, and if you want to read through this, you can pause this and kind of read through it. I'm just going to go through each one real quick. You want to make this attractive. You want to make this eye-catching. This is small. It's on a small screen, but if it was on a big screen, this would be readable, much more readable. Excuse me. Included the survey, which is awesome. It's always a good idea. Okay, and the make sure it's attractive. There's a couple other ones that I have. Make sure that you use color. Make images, graphs are great, pie charts, whatever. Because visual presentations are important, especially when you're trying to attract shareholders. You're trying to get people interested in this. This is another kind of a cool idea one. Again, I'm just going to go through this real quick. Rheumatism, treating autoimmune disorders. And I'm sure everyone knows what rheumatism is. I'm just going to go through it. And, prevalent and underserved, unfortunately, autoimmune disorders. Primarily because there's not a good drug therapy for it. That's primarily what it was, and there's no vaccine. Fortunately, I'm going to go through this again. If you want to go through this and pause it, feel free to do so. I'm just going to kind of skip through it. Key components: autoimmune protocol diet, very, very important. That's probably the most important aspect of autoimmune disorder. So I just want to stop right here. Regular exercise, environmental conditions, stress management. That is the treatment, the evidence-based treatment for autoimmune disorders. If you know anybody that has an autoimmune disorder, and I know several people, I'm 46 and I have a lot of friends, female friends that are starting to develop these disorders. And it's because, hopefully they're starting to get it that they need to switch over this. The diet seems to be the hardest part because it's essentially a plant-based diet, 90% plant-based diet, at regular exercise. The exercise, the physical activity is tailored to everybody's specific condition and interests and environmental conditions and things like that. Stress management, extremely important. So what we're talking about here, of course, is lifestyle medicine. Okay, I've talked about that across the board. You need to, most likely, depending on your disorder or whatever disease you're treating, and I've seen everything from addiction to autoimmune disorders to cancer. That lifestyle medicine has to be at the center of that from an evidence-based medicine standpoint, without question. So make sure that you're incorporating that into your thing, because you will get dinged on that. This one was huge. This was, I shouldn't say it was huge. This was just really, really well done. This was perfect. I love this one. And this is, and there you go. Of course, all our references are there. The way I see myself is that I'm trying to take all you folks who have incredible expertise and experience in your field, and I'm just trying to tailor your expertise into a public health mindset or framework, because and then hopefully you can start to do this because public health is starting to become much more prevalent, or hopefully it will. Anyway, that's the plan. Let's hope so. This is another one. Of course, this was a physician that was in the class previously, and this was perfect. Another one, of course, you would expect it to be perfect from a physician. But again, I'm going to kind of go through this pretty quickly. And, it's just this one, although I would say that this is very attractive personally. Let me make this a little bit bigger so it's a little bit easier. I personally would say that, I think this is eye-catching, and it doesn't include any fancy graphs or charts or pictures, and that's fine. I would say maybe, it depends on who you are delivering your presentation to, and that's really what you need to consider. This was done by an MD, and this is a presentation that I would expect to see delivered to a group of medical professionals. Now, if you were doing something, delivering a program that you were trying to engage people at a YMCA or at an elementary school, it might look a little bit differently. So you need to tailor and again, for this presentation, whatever you do, whatever you want to do. But I'm saying if you are actually going to do this in the future, you need to tailor your presentation to the appropriate audience. And there's a whole thing about, it's a whole strategy in marketing, and especially public health, especially, but in marketing in general, is that you have to write your work appropriate to the audience that is receiving this. And one important thing to note is that most people out there are reading at about an 8th grade level. So that means what they recommend is that most health information, most medical information is written at an 8th grade level, because that is kind of easy for people to read and not get too confused. And if something is too medical or too technical, they tend not to read it. So not for this presentation, because this is for a graduate. You're presenting for graduate students here. So, but if you are actually presenting to, and especially if you're developing health literacy information, you need to write at an 8th grade level. And if you're developing health literacy information in an inner city, it needs to be written appropriately, and you should probably consult with experts in that field, social workers particularly. So that's it. That's all I have for right now. I hope this was helpful. And again, if you already posted your presentation, if you already submitted your final paper, and you want to, just kind of readjust it and resubmit, you're welcome to do that. No problem. No problem at all. Okay? I hope this was helpful. Again, I am available Friday, tomorrow, Saturday. If anybody needs I'll be online if anybody has any questions. Okay? And if you need, a phone call, just let me know. Take care, everybody.